Welcome to the panel discussion organized at the Leave No One Behind Film Days. Leave No One Behind is an initiative of World Health Organization Turkey in collaboration with Ministry of Health, and it is funded by the European Union. We aim to contribute to the activities evolving around April 7 World Health Day. We hope our films may help to build a fair and healthy world. We would also like to get your attention to 2021 International Year of Health and Care Workers. It has been designated in appreciation and gratitude for their unwavering dedication in the fight against the COVID-19 pandemic. Our selection primarily focuses on the life-changing health services for immigrants and refugees, because health is a fundamental human right. Under this topic today, we will discuss a very special documentary, Wake Up on Mars. We have the honor to have the director and producer of this film, Dia Gjinovci, with us. Welcome, Dia. Dia is a Swiss-Albanian filmmaker with a background in economics and anthropology. And her award-winning documentary short, Sans le Kosovo, screened at several international festivals and won Best National Film at DocuFest International Film Festival. Her debut feature-length documentary is Wake Up on Mars, and it has been selected as a part of the 2020 Tribeca Film Festival in New York, among other international achievements. And today we have also the honor to have Mr. Altin Malaj. He is the coordinator of the Refugee Health Program. He is managing the whole program, so he has a bird's eye view of all the refugee health operations in Turkey. And he's got 12 years of experience with the WHO and 21 years of expertise on health system and public health, among other activities. And also Dr. Zühtü Benli. He is the Ministry of Health official working in Izmir, and he oversees the Refugee Health Training Center located in this city, where they train Syrian-made MDs to complete their adaptation process to the Turkish health system. So welcome everybody. With your permission, I'm starting with Dia Gjinovci because the film itself is not only very moving, but it's also very interesting because it brings forward a very little known subject, the resignation syndrome. So Dea, could you please tell us how you met this family and how did you evolve in making this project?
Thank you so much for having me. I'm really glad I get to participate, and really because it's something, developing this film, I really understood the importance as well of taking care of the mental health of refugee and especially refugee children. And it's a topic that touches me a lot. And so I first heard about the resignation syndrome when I read an article in the New Yorker in 2017. So it was an American journalist who went to Sweden, and basically she was describing this affliction that was affecting a lot of asylum-seeking children in Sweden. So about 100 children every year, where they would, when they learned that they would be deported from the country, they would slowly fall into a form of apathy. So it was like they were giving up. They were giving up on life because they felt like there was no hope for them to stay and remain in Sweden, for them or their family. And so the way it happens is that slowly they stop feeding themselves, then they stop getting up from bed, then they stop talking. And so they're really, it's a process that's nearly sort of impossible to stop because it's something that really happens psychologically and physiologically. And so some of the more, the less heavy cases, you had a form of apathy where, they sort of would refuse to eat, but they would like still be conscious. And then the worst cases were the cases of coma. And so you had, cases where children had completely lost consciousness and really were in a state of coma. Similar to someone who had like a brain accident or something like that would put them in that state. And so what happened is that I met so I read the article and then I met the doctor who was interviewed in the article. I met her in Sweden and she introduced me to a few families, and amongst them was so there was a Yazidi family, an Armenian family, there was a Syrian family, and then there was a family, a Roma family from Kosovo. And so that's the Demiri family that you see in my documentary. And they had 4 children and 2 of their daughters who had been in a coma for several years, one of them for nearly 5 years and the other one for 3 years. And so you can imagine the toll that it took on the family, and even the toll it took on the daughters as well, of, you know, losing years of puberty, of growth, of adolescence, you know, sort of spending them in a coma state. It was completely shocking and mysterious. And so this is why as well I wanted to understand what lied beyond that. What was the psychological burden that they were carrying, to understand why they would put themselves into that state.
Well, Janetta and Ibadeta are, you know, in this, coma. So it's very depressing to watch only them and their story. But you also focused on Furkhan, the little boy, and who gave the documentary the title, right? Wake Up on Mars. So because he dreams of going to the Mars. I was curious, how much of this was his own, effort to build this spaceship, and how much of it is the film crew who helped him to turn this into a kind of, let's say, docudrama, right? It has a kind of dramatic aspect.
So the first time I met Furkhan, you could see, you know, he was like 8 or 9 years old at the time. And it was quite, you know, it's those moments where you just see a child who tries to be happy and tries to, you know, but at the same time holds on to a deep, deep sadness. And you could see that whenever he would laugh, right away he would withdraw again. And like the sort of the burden of like everything that was happening in his family, and the uncertainty and the insecurity and the feeling of guilt he had towards what had happened to his sisters was overwhelming for him. And so one of the things that he said when I first met him was like, I don't want to live on Earth anymore. I want to go and live on Mars and forget about everything and everyone. So it was, in a way, it was a way to escape, you know, the situation for him. He had built a sort of like imaginary world where he would live in space. So it wasn't even like just a fondness for, you know, astronomy or science. It was very much like a necessity that, you know, there was another way out, you know, that there was another way to live somewhere else. And so what I decided to do, thinking about it, I thought that for him, it was like his sisters had found, in a way, you know, a way to disappear from the situation with the resignation syndrome. For him, it was a way to build an alternative reality to this space-like, environment. And so first, what I said is that, okay, so if you want to go live on Mars, you know, you need a spaceship. How are you going to do it? And so every time I would go back, first we started drawing the spaceship, then we started making the spaceship with cardboard boxes, and little by little going back, it was getting bigger. And every time he was asking me, what are we doing for the spaceship this time? When is the spaceship going to happen? And so this is when I was like, oh my God, we have to build the spaceship now, it's real. And so I started working with a few artists from Paris, a few friends of mine, one of them who came to Sweden to meet Furkhan, and he spent 1 week with him. And they would go around the different forests around his village and the different junkyards where you had, car parts. And together they would start, you know, doing workshops to start building the idea of the spaceship. And then afterwards, one summer we came with a bigger crew. And so in the morning, Furkhan would build with the crew, and so we would film him, and then in the afternoon we would film other things with him. So it was a collaborative work. Obviously, there's a big crew and artistic crew behind it too, but he was always kind of the driver, and it was always built so it could really, visually translate his imagination and his desire for the spaceship. And also for us, it was very important to, trust that the audience will understand that last moment where the spaceship, flies away, it's very much something about, believing like Furkhan believes, and hoping that the girls will wake up, and that's the dream that, by flying away, he can find them again.
Yeah, thank you very much. It's really very moving, and we can feel them all, the whole family, thanks to your magnificent film. Mr. Malaj, this is really a very unique story, right? I mean, I'm sure you know so many unique stories among the refugees and immigrants, but still, maybe you would give us your professional view of the film.
Well, yes, thank you. First, I'd like to start by thanking Dea and her crew for the amazing documentary or movie, or whatever the correct word is. I had the pleasure of watching it and learning from it. I mean, it was my first exposure to the withdrawal syndrome or resignation syndrome, sorry. Then I had a chance to look further. In the same year, BBC, I think, published another article on the phenomenon. It talks mostly about the cases in Sweden, but I just heard from Alin that several other cases are reported elsewhere. Australia, was it correct?
Yes, Australia.
Yeah. So, but the thing was very moving, also because I had the pleasure of sort of listening and understanding it in the original language as much as I could. I'm also Albanian, so it was really touching and emotionally very sort of I don't know what the correct word is to explain it, but I really sort of lived through the documentary and felt all the challenges that the Demiri family in this case faced in their struggle to migrate from Kosovo to Sweden. So it was very moving. I learned a lot, and I enjoyed it, especially the very optimistic ending with a spaceship, fly out of the present situation. So I really enjoyed it, and I really want to thank Dan and her crew for the amazing thing that they produced. So.
Dr. Benli, I think you would also agree that this is a very unique documentary, yes, a unique refugee situation. What is your experience with these, kind of families under extreme stress?
Evet, ben öncelikle Dea'ya çok teşekkür
First
ediyorum.
of all, I would like to thank Dia because this was a humanitarian tragedy and she touched upon a very different perspective. So it was very good reflected in the film. This is an humanitarian crisis, and all those individuals, they would like to continue their lives in an honorable manner, in a healthy manner, and they would like to make a new start, new beginning. So they try to move to another place, another country. When they reach, after the arrival, of course, within the scope of their own legislation and law, each country can have different reactions. Of course, in Europe, there is the fear of deportation and also some restrictions in the camps. Life in the camp, it's really important because sometimes you cannot be fully aware. For example, abuse, exploitation. There could be girls, boys. So this abuse can also be experienced, and there could be post-traumatic stress disorder. So such cases, they are related to the fear of deportation, or you go for a new beginning, you leave everything behind. This is not something really easy. And when you arrive, then you start feeling that fear of deportation, hopelessness. And, all those adolescents, they have different negativities experienced in those camps. Then this makes all those people introvert. Furkhan, in the film, actually, there is a great support from the film crew. Furkhan tried to find a way out, actually. Maybe if there won't be the support of the film crew, maybe he's not going to find that way out. This was a great coincidence, I think, for him. And for Izmir province, we do not face such cases. I've never seen such cases because, you know, migration case, it's not something easy to discuss. There are traumatic cases. All those children witness, all those children experience those traumas experienced by the families. They start their journey from Syria until coming to the borders of Turkey. They experience all those trauma because they are coming from the war itself. Of course, there's no fear of deportation in Turkey. I mean, we don't have the restricted camp areas for the Syrians. I mean, we can see all those Syrian individuals, but we have some other problems. We have financial, I mean, there could be economical problems. There could be some problems related to the lack of health literacy. Moreover, I would like to highlight another issue for Izmir province, because, you know, when you look at the map of the country, I mean, when you try to think of the location of Izmir, you know, in southeast, we have Urfa, Antep, Hatay provinces. So it's close to the borders. So Syrians come from those borders. So these are the entry points. Izmir at the other end is like the exit point. And 2 days ago, maybe you have followed from the media press, there were in 4 or 5 different places, Turkish Coast Guard, Izmir Coast Guard grabbed 230 refugees from the sea. And of course, we have another neighbor across the sea, Greece, and we know their decision. I mean, not accepting all those refugees, but sometimes we can see push back or trying to sink all those boats. So all those Syrians, you know, we have seen kids as well. Of course, there are not only the Syrians, Afghanis, some other countries, irregular migrants, and especially in cold weather climate conditions, you know, we can see hypothermia, because hypothermia is a very significant health issue. And then the traumas all those individuals experience, you know, these people lose their families, kids lose their families in the middle of the sea. So there should be a rehabilitation for all those children. And maybe as the dream of Furkhan, maybe there could be different activities related to those dreams of children. And you know, this
Dr. Benli, we will also have
resignation
you know, the
syndrome.
second part. Yes, we can continue discussing you know, a little bit more, but maybe it's better to speak in shorter terms. That's why.
Bu kadar yeterler abi.
This is enough then, okay.
No, we will come back to you, of course, but you know, it's nice to you know, change a little bit. So we see that there's a huge problem, you know, concerning this fluxes of people, right, Mr. Malaj? And you have been in charge of the World Health Organization programs for a long time. And not only in Turkey, you have been the, you know, regional manager. So how can we avoid these tragedies? Let's say resignation syndrome is a bit of an extreme, but there are many other traumas. Each you know, refugee can go through very hard time under extreme stress. So can you tell us a little bit about how you work and what are the programs to keep them healthy?
Yes, I'll try to summarize it very briefly, as not to take too much of your time. But so, as you know, Turkey has a very unique situation. It basically welcomes and hosts millions of what I would call both refugees and migrants. Only from the conflict in Syria, we have 3.6 million refugees, where Turkey is not only hosting them, but also giving hope for a new life, providing support for free services, including education and health. And our program, it's basically instrumental in supporting the Ministry of Health to provide the necessary essential health services to 3.6, 3.7 million Syrians under temporary protection in Turkey. But in addition, there is around 400,000 additional migrants, which are not necessarily from Syria, but from other areas and other, let's say, migration routes, which are currently in Turkey. And again, even for them, Turkey is providing generously protection, shelter, and free access to services, including education and health. So from that perspective, I can also try to sort of link the challenges that the migrants or refugees have in a destination country and see specifically the issues related to access to health services, which is something that our program is a little bit more relevant or linked to. So I was watching the documentary with very much interest to see how the access to health services for this very unique or very particular case was taking place in Sweden. So, and I think also in the documentary itself, there's a small comparison between the Swedish health services and the health services provided in Kosovo. So yes, migrants and refugees, they basically they leave their countries of origin for many reasons, which I would call or summarize as push factors. And then they go to specific destination countries, which in this case, Sweden, also because there are pull factors. I remember from the documentary that the rest of the Demiri family is already located in Sweden. So I don't know whether that would be considered a pull factor, but I'm sure there are also other issues related to that. Most probably a historical sort of welcoming position of Sweden towards migrants and refugees overall. Or I don't know what other, the level of development or level of health services. So I'm pretty sure that they also play a role in selecting Sweden as a destination country. But once there are a lot of challenges that the migrants and refugees can face. Pretty much that would be related to the ability to adapt to the new life, and also with what they call daily life stressors, and also the issues regarding future integration. So I'm pretty sure a combination of all of those factors influences both the physical and the mental or psychological well-being of migrants and refugees. Particularly in our program, we work very closely with the Ministry of Health to support their mental health and psychosocial services, among many other things. And we have found in the past that based on surveys that we've done together with the Ministry of Health, that up to 37% of migrants and refugees express signs and symptoms that could easily be diagnosed as major depression, for example, but many others, so major depression is the main sort of challenge to their mental health, but there are other psychiatric issues related to the mental health of young adults and adolescents, but also the psychological pressure related to the daily stressors. So that would be pretty much the three sort of challenges to their mental health and well-being overall. So our program support to the Ministry of Health basically is translated into support for training for mental health and psychosocial professionals. So in the last 3-4 years, we've been working with the Ministry of Health to provide what we call MHPSS, meaning mental health and psychosocial support training for more than 3,400 Syrian and Turkish health professionals. And all of these health professionals are basically serving in the front lines with the Syrian refugees or Syrians under temporary protection in Turkey. So We enjoy a very good working relationship with the Ministry of Health, and we are, I take the chance to thank them publicly for the support they provide to the Syrians in Turkey, but also for their strategic leadership and support to our activities in Turkey.
Oh, that's really good to hear all these, services. But I must, contest that having a documentary crew helping a refugee family is also really very effective, right? It's such a positive effect. Dia, have you kept in contact with the Demir family? And do you know what kind of healthcare services Janetta and Ibadeta are having at the moment? I mean, after so many years of coma, can they physically move freely? And then how about their, I don't know, mental abilities? Is everything okay with them?
Yes, so I'm in touch with the Demiri family quite often. I think we speak every week or every 2 weeks still. So especially, making a film for nearly 3 years where you're completely embedded within the family and the struggle of the family, and also this hope that the girls will wake up. So it's something that never really goes away, and you kind of live that with the family too. And so when they woke up about a year and a half ago, I would say that so Ibadeta woke up first. She was the one who had stayed the least amount of time in a coma, and so for her the rehabilitation was quite relatively fast. In terms of she started talking again a little bit after a few months, and then she could get up and then she could walk, and she hadn't forgotten Albanian or Swedish, so her faculties were still kind of the same, which was very encouraging and quite amazing. Whereas for Janetta, it's different. So Janetta, her coma was very long, and the way she got into the coma, she was already very weak. So she had lost a lot of physiological abilities, and so even now she's still using sometimes a wheelchair and then crutches, and I think has more difficulty as well with memory and sort of language. The thing is, in Sweden, it's kind of there is this paradoxical aspect to Sweden that you have all the health services that are provided, and it's you will have a social assistant, and then you can have a psychotherapy, and then you can go to the hospital, etc. But it really depends on the different locations you're in. And the problem is that, for example, what's happening right now with the girls is that they cannot be educated in normal, high schools. So no high school has accepted them for the past year, nowhere in Sweden. And so they're in this limbo state where cannot go back, but they need to get to at least a certain level to continue their education. And their dream, both of them now, is to become nurses. So there's also the fact that they've gone through such a difficult medical journey. For them, it's important also to give back. And so it's kind of heartbreaking to see that they're limited in that aspect. One of the other factors that has been very negative is that in November, the permanent residency permit of the family was refused. So it means that they cannot, they're still in limbo again. So they might receive a deportation order from Sweden, and that's very. I mean, you think about it, and you're like, this family has been in Sweden for so many years. I mean, I think Furkhan speaks better Swedish now than Albanian, and then we're still this completely integrated. And these girls have finally woken up because they thought they could stay in Sweden, and they had this, glimmer of hope that things would get better. And it's just so heartbreaking to see that still, after all these efforts, all these things, there's still a negative decision, coming their way. Whereas they've shown that, they want to be integrated, and their life for them is in Sweden. It feels like, it feels very hard, I think, and the hardest is the sacrifice for the parents, because, what they used to tell me was if we're not strong, the foundation of our families crumbles. We have to be the strong ones. We are the parents. We have to, hold on all the time. The problem is that they also live with trauma, and they also live with, psychological, negative psychological effects of everything that is happening. And so even if it's not directly said to the children, it's felt by the children. So the children internalize everything that's happening for their parents, and the constant stress, you can feel it. And so I remember the first times I used to go to the house, I would leave after a couple of hours with like a headache, and like really like kind of like the sense that like it was heavy. The life there was heavy because there was so much, you know, burden, like psychological burden held on by the whole family. And this feeling was lifted just when there was like sort of the temporary temporary residency permit, and things were going smoother for them. And one thing that you were saying about the documentary crew helping children, it's kind of true, because, you know, whenever the children, you know, Rasul and Furkhan, they would love to be outside, and they would love to be outside with us, you know, building, constructing, sort of like making their dreams happen with the documentary crew. And it was so important to give them an outlet that's just not related just to the fact of like, where am I going to live? You know, where am I meant to be? Something that's really more deeper about, you know, who they are and what they can be in the future. And that's very important to always keep that window open, because hopelessness is very much, you know, destroying these children in different ways. And so it's always about keeping the hope alive that, you know, their destiny will be transformed. But also it has to be done through the governments that need to take their responsibilities as well, you know, like for all these things, because you're very much destroying long parts of people's lives where they could have benefited society, they could have given so much to society, they could have improved themselves, they could have become, you know, something beneficial to society. And if a government doesn't do that, it's just wasting time, you know, people's time as well. They're losing years in limbo, not knowing where they're going to live.
Yes, really very heartbreaking and very disappointing from many aspects. Thank you very much, at least, you know, caring about this. So, Dr. Benli, what Dia tells me reminds me of the critical situation in Izmir. As you mentioned, you know, Izmir is a way out, you know, toward Europe for many refugees from the east and the south. So, as you mentioned also, there are many times and there are disasters in the sea, and when they are brought, you know, in Izmir or in the region of Izmir, how is the process? You know, what happens to them? You know, maybe some of them are wounded, or I don't know, hypothermic. Can you tell us about this process? What kind of services do you provide for them?
Altin Bey de bahsetti.
As Mr. Malaj stated, as of the beginning of the process, as the Minister of Health, we provide services for Syrian refugees. We provide healthcare services for them. And all those services are primary healthcare services, we call them as such. We have the family practitioners, family physician centers, and we have directorates of migration, so they can have all those health services. Of course, the settlement of those Syrian refugees, you know, we have the case of registration, because first of all, they need to have the registration. There is no problem related to the registration. Maybe recently, due to the pandemic in Istanbul, Ankara, and in some metropolitans, there could be some restrictions. There are available settlements, of course, but for example, a person living in Urfa, moving his residence permit to Izmir, maybe this can be a little bit difficult, but there are some rules. For example, this person should have the employment, or there could be a health case, and then these people can submit health reports. So practically, we don't have any restrictions in terms of settlement. In Izmir, we have nearly 150,000 Syrian migrants, registered ones. The non-registered ones, maybe 40, 50, 60,000. I am not sure about that, but we estimate that probably there is a great number unregistered Syrian immigrants. So we made a study, especially for the settlements in the camps during the pandemic. We made a visit, and of course there were some additional burden. So we made the PCR tests in those camps, and then we tried to examine the demographic characteristics for all those refugees. Of course, I'm talking for the camp settlements, and 1/4 is registered in Izmir. 2/4 is registered in southeastern cities, and 1/4 does not have the registration. Why? Maybe they want to have the exits. I mean, they're not going to stay anymore. So when I express as exit, actually we have less number. Recently, maybe you have seen in the news, in internet, I would like to open one of the photographs. Let me show you. I'll show you. So you can see the boat on the sea. People try to save all those people, and they try to save all those people from the boat. And this boat is bursted. So they're all in the sea. There are too many children. There are babies. There are young people, elderly, women. Some of them are lost. Maybe some of them died. Maybe we are going to hear that they're drowned. So this is something different, a different tragedy. In Sweden, in Greece, in islands of Greece, the tragedy is different in those people living in the camps. Of course, first they have the hopes, and then they experience traumas, physical ones, and then post-traumas. They are all different. In our country, we don't have if there won't be any criminal case, if there is no relation to the terrorism, then it's not possible for that refugee to be deported. Only in some specific cases, there could be the intervention as deportation. Therefore, there is no fear of deportation in the country. For the camps, we don't have closed circuit camp conditions. And in 2011, when all those camps were established, different groups were, there were different conflicts between different groups, then all those camps were separated, emptied. Sometimes we can hear in different countries, in Europe, in Greece, in Mytilene Island, for example, in Lesbos, so we can see, we can hear that there is sexual abuse to the girls, to the females. There are non-accompanied children in some other Europe countries. So we hear different problems, and they're all infrastructure for that resignation syndrome, actually, the negativity, the fear of deportation, witnessing all those traumas experienced. So when you gather all of them, actually, we see such problems at the end. Of course, we are never come across with such case, but we have different mental health problems. For my own province, when we look at the demographic structure of the Syrians, they are different compared to the demographic features of the Turkish citizens in terms of age. For example, above the 50 years of age, it is less, 10 times less. The young population is 2 times more for Syrians compared to Turkish citizens. So This means that while moving towards west, maybe they leave the elderly behind, for example, in the southeastern, because maybe they want to stay close to their homelands, I mean, to their own country. Maybe they leave some of the elderly, some of their relatives behind. Of course, we have different mental health problems in terms of health, education, employment. We provide services for Syrians. We embrace them. There is no difference for the services provided compared to the Turkish citizens. But we are not a rich country. Of course, we can have economic and social problems, and then these problems bring and cause parental family problems. And Dr. Benli,
we are really very grateful to you, but we have completed our duration. So it's really very good to hear all these services provided, especially in Izmir, where it has become a kind of safe harbor for the refugees from all around the world. Unfortunately, we have run out of time, so I will kindly ask, first of all, I thank all of you for contributing, and with the permission of the gentleman, I will ask Dia to, share her, intentions and last words with us.
So first of all, thank you so much for inviting me, and really, and thank you to all of you, and to Professor Benli, Mr. Malaj as well, and you, Alin Taşçıyan, because even just it's so insightful to compare the different experiences and to see that at the end of the day, there are certain things that we all share in terms of, how what we need in our human lives, and it's hope, it's dignity, it's living, with the sense of safety, and that in different countries, obviously, there are things that are done better or not as well. And so, I mean, my aim with this film was really to kind of touch people in their heart through the fate of this family, and so they could identify with that family no matter where they came from, that it didn't matter that they were Roma from Kosovo, whatever, and that they were really just because the destiny of this family was important. And I thought that to the eyes, and this was could be done the best by telling this story through the eyes of the children. And so I hope that this kind of stories as well help us discuss these matters in a more nearly humanistic manner and philosophical manner about, what do we want, to build together, and what do we want to see for the world. And so I'm very glad that these kind of conversations are happening because of the film as well. So thank you so much.
Thank you so much. Thank everyone so much. So our program can be followed on festivalscope.com. All our films and all our panel discussions can be watched between 5 to 11 April. So we always say leave no one behind, and this documentary, Wake Up on Mars, was a wonderful opportunity for us to touch the point. So even on Mars, we leave no one behind.
Yes. Thank you so much.
Thank you. Bye.
Teşekkür ederim.
Ben teşekkür ederim.
thank you.